Peyronie's disease is a scar tissue disorder of the tissue that surrounds the erection chambers of the penis. That scar tissue can contribute to curvature or shortening or pain during erections. Most of the time with Peyronie's disease, we do not know the exact event that contributes to the scar formation. Sometimes we do have a single episode that is well identified. Most of the time it is felt to be a buildup of a repeated micro-trauma to this tissue during repeated sexual activity over many years. Peyronie's disease can affect erections and intercourse in several ways. Number one, if it causes penile shortening, that can certainly affect partner satisfaction and patient satisfaction with intercourse. Number two, if it contributes to pain with erections, that could prohibit the ability for sexual activity due to discomfort. And number three, sometimes the curvature is so significant that vaginal penetration cannot even be achieved. Peyronie's disease is diagnosed typically by a patient history. It is then usually confirmed with ultrasonography performed in a urologist's office. Treatment options for Peyronie's disease are relatively limited. Historically, there were a variety of medications that were taken by mouth or placed topically onto the penis. It has been felt over time that these are ineffective, and our standard guidelines do not recommend use of these. There is an FDA-approved injectable product called Xiaflex that is routinely utilized, and if this is ineffective, then surgical reconstructive options do exist, including penile prosthesis implantation. For a man who is able to have sexual activity but has significant curvature or shortening of the penis, but is able to have an erection, we typically would prefer an injection approach with Xiaflex initially. If erectile dysfunction persists, then we also may wish to consider a penile prosthesis approach to address the erectile dysfunction and the curvature abnormalities. Peyronie's disease, typically after its initial presentation, may progress or change over the course of about 6 months. After a 6-month time frame, it is largely going to be what it is without a great degree of change. If that is pain with every erection or curvature that prohibits vaginal penetration, then it drastically alters a man's ability for sexual performance that is satisfactory. So typically that is the decision that prompts men towards treatment.